Hi, I'm Dr. Prashantha Kesari, Senior Cosmetic, Plastic Reconstructive and Microvascular Surgeon practicing out of Nypunya Plastic Surgery Team, Bangalore, India. What is facial palsy? Facial palsy is paralysis of muscles supplied by a nerve called facial nerve. As the name itself says, facial nerve supplies muscles of facial expression, that is raising the eyebrow, closing the eyes, and then flaring of the nose area, smiling and pursuing the lips and neck. So these are the expressions which are controlled by the muscles which are supplied by facial nerve. When this gets paralyzed, it is called facial palsy. So what causes facial palsy? So it can be of two types. One is, it can be because of the nerve itself is under an inflammation, like Bell's palsy, where nerve related problem hai, so there is a paralysis. Or it could be a part of stroke. It can be because of a brain hemorrhage in the brain and it is affecting facial nerve areas, so facial palsy can occur. So apart from this neurological condition, facial palsy can occur because of problems in the parotid gland. There is a gland called parotid in front of the ear. There, if there is some problem, then the nerve can get compressed or engulfed in some tumour and facial palsy can occur. It can happen after some surgeries like parotidectomy. If you have to remove the full parotid, then sometimes it is sacrificed. And then often facial palsy can be congenital without any reason. So the causes of facial paralysis are multiple and these are the few important ones. Facial palsy affects the appearance of a person, especially it is dangerous for the eyes if he is unable to close his eyes. We have a reflex called corneal reflex. If something is coming close to our eyes, we automatically reflexly close the eye, that reflex will be lost. So injuries to cornea and further eye damage is a side effect of facial palsy. So that needs to be taken care of. Apart from that, when they smile, there may be a crooked smile. That is not that much of a problem, but it do bothers the persons and it brings down their body image and self-image. So that can also be corrected. And if you are eating, that if there is dribbling of food from the corner of the mouth or food getting stuck in between your teeth and cheek, that is another problem of facial palsy, and that also gets improved when we reconstruct. Apart from that, if you can't raise the eyebrow or if there is a change in the way you speak, and you will not be able to do things like which involve blowing of air forcefully. These are some of the consequences of facial palsy. And when we correct all this, your vital facial structures like eyes and eating and these things are taken care of and your body image definitely improves.